Hey guys, I am going to do a quick lecture over self-concept. It is actually Unit 7. I was originally scheduled to do that lecture on Monday and Thursday and take 2 days because it is like 6 chapters to cover. All of the chapters are very, very important to nursing. So instead of me doing self-concept in the classroom, I'm going to do a video lecture here in my apartment. Anyways, bear with me. It is my first pre-recorded lecture. I do like feedback and ask questions during lecture, but I'm going to go ahead and do it this way. That way we can save a little bit of time and you guys can still get the needed information, because I felt like that this is something that I couldn't leave out in the lectures for next week. So I'm going to be talking about self-concept. Let me share my screen real quick, then you guys don't have to see my face. So let's share this screen here and we will just go ahead and move forward with this. So we're on chapter 41. I'm starting on page 1633. I kind of adjusted the lecture a little bit to include some other things other than what we find in the book, which is why I kind of have this PowerPoint separately. I will post this and also a video in Moodle. So once you complete the lecture, feel free to use the PowerPoint. Please watch the videos, and then we'll go from there. Next week, we'll finish out the rest of that Unit 7. So self-concept. So basically, self-concept is what you perceive yourself and how you perceive yourself. What is it that you want, or who are you, or what do you want to do with life? And it really does make us very, very individualized and very unique as human beings. So as we're talking about this and the entire lecture and building it, I kind of pictured it as, okay, this is going to be helpful for my personal life, but it's also going to be extraordinary for our patients. And so try to look at it in both ways and utilize the same information that I'm teaching you guys to help you in your personal lives and also in your nursing lives. So self-concept is kind of, it ties into your self-concept and your self-worth and your worthiness and how you view yourself and how you perceive yourself. It can be both positive and negative. We can have negative self-assessments of ourselves. Physically, emotionally, we may not feel as smart as our neighbor next to us. And then also functionally too, I can't perform as well as so-and-so, or, I always think about self-concept of when I was a teenager, or when I was in those growing pain years where I just never felt like I was good enough or worthy enough for the people around me. There's always somebody bigger and better than you are. It can affect us over time, and it can kind of affect us negatively or positively based on our assumptions of us and how healthy we are. How healthy are we mentally? How healthy are we as far as our physical health? So it really can affect our ability to function, and it can definitely influence our health status. Definitely, especially when we're looking at our mental health, so if we have a poor self-concept of ourselves, we're not very happy, our mental health can definitely be subjective to some really negative outcomes. So there are 3 dimensions of self-concept. We have, let me move that out of the way. So those 3 dimensions are basically your self-knowledge. who am I? Who am I as a human being? Who am I as a nursing student? Who am I as a mother? Who am I as a wife or a spouse or a father? Who am I? What is your self-knowledge? So that kind of begins that dimension of your self-concept. So what's your expectation? Self-expectation. Who do I want to be? What do I want to be? Um, a lot of you guys were there deciding on, I want to be a nurse. And now it's like, I don't know what kind of nurse I want to be. So what kind of nurse do I want to be? So you've kind of got this expectation of who or what do I want to be? And then you have this self-evaluation dimension of self-concept. So like, how well do I like myself? Do I even like myself as a human being right now? Do I love myself? Am I proud of who I am? So those are the three dimensions of self-concept. So we have several different components of that self-concept as well. So we have dimensional, and then we have the components of our self-concept. So our identity, our body image, our self-esteem, and what's our role? What's the role performance here? So we, let me move this out of the way over here. I may even just take that box down. So let's start off with identity. Let's go here. So that's kind of the interrelationships of those four components right there. So you see that self-concept is in the center. So how do we view ourselves? What is our body image? What is our role? What is our physical role, and what's our performance within that role? And then how do we identify with ourselves within that, or how are we identified from other people? That is our self-concept. So let's start off with identity. A sense of personal identity is what sets one person apart as a unique individual. So our identity includes our name, our gender, our ethnic identity, our family, the occupation that we have, and the roles in which we have in our lifetime. So of course, our name has a huge part in our identity. I get so angry sometimes whenever you guys call me Mrs. Ward, because I don't identify as a Mrs. or I don't identify as a Miss. I identify as Brandy. That is my name. That's who I see myself as. Of course, our ethnic identity has a great, I mean, that is who we are to the core. Our family status, what's going on in our lives, that's how we identify. Are you married? Are you single? Do you have children? Are you divorced? Are you in a complicated relationship? That is what your identity is at any given time. Of course, when I think of occupation, I am a nurse. That is how I identify myself. That is who I am to the core. So all of those kind of include and embody your identity. So it does start developing within our childhood years, and it's constantly changing, constantly modified as we grow. Things change, our lives change, things happen to us, they happen through our lives. It's pretty fluid. It's even reinforced through our life. And a great example of that reinforcement of identity is, you guys have probably heard a lot about, this role reversal and transgender. These children, are constantly like, you're a boy and you are a girl. And so that is reinforced by our parents and how we identify with ourselves. I'm not going to dress my son in a dress because he is a boy, because that is what he needs to wear. And then you have some that just, well, they can wear, they can wear whatever they want, which is that is how they build their identity. I think that's one of the arguments, is that your identity is so much reinforced with those transgender, um, as far as the transgender roles, um, that, it's just kind of like my identity was forced on me. I didn't ask to wear pink, or I didn't ask to be wearing dresses when I was a little girl. So but that's how society works, and that's kind of the change that people are wishing to have, just so that people can kind of have their own unique identities, and can kind of um, select their own self-concept as far as their identity is concerned. So there is definitely some modification that we have to deal with throughout our lifetime, especially as things change, and as things move along, as we grow. So we go from identity, and then now we go to our body image. So our body image is just an attitude about our physical self. What are our characteristics? What is our appearance? And how are we performing within that? How's my body performing up against somebody else's? So I feel like that women have this a much greater sense of body image, self concept, because it's kind of a constant a comparison. Women do that naturally. I think that's just a part of our core. That's just what we do. Not to say that men don't do that either, but it is definitely dynamic, because we can change our body, we can change the way we look so easily, and we can even change the function of our body too, based on what we're doing, both negatively or positively. So you can gain weight, you can lose weight, you can have plastic surgery, you grow, you change, you develop. I'm talking about those adolescent, prepubescent girls, when they're younger, and then all of a sudden they start growing and developing breasts, and they look different, and so their body image changes, their self body image changes, and that can definitely affect how they view themselves. It can be the same with our the younger boys. They're changing, they're starting to get bigger, their shoulders are getting more broad, they're really having a difference in the way they see their self and their body image. Another thing is a self-ideal. So self-ideal is a perception of behavior based on our personal standard and our self-expectations. So we have an expectation for ourselves of how we're going to be successful. And so we have those personal standards, or most everybody has personal standards that says, okay, I'm going to do this, and this is what is expected of me, and this is what I'm going to do. And so it's very much internal. It is an internal regulator per se, to kind of support that self-respect that we have for ourselves, and that self-esteem that we have. So it's a self-ideal. So the ideals that we carry, um, based on our personal standards and self expectations. So it is definitely that internal regulator that helps that support of self respect and self esteem. So let's talk a little bit about self esteem. Self esteem is definitely one of those that we have to remember that self esteem is what we feel and about ourselves. This is the judgment. This is a personal judgment that we have for ourselves. So yes, other people around us can affect how we view ourselves based on what their perception of us, but really self-esteem is the judgment of a personal performance compared with the self-ideal. So if we compare self-ideal, that's what our expectations are, and then self-esteem is where do we land there. So are we exceeding what our expectations are? Are we meeting them? Are we falling below? And so usually when we have the self-ideal, we've got a standard that we are at, and then self-esteem plays in, is like, okay, where do I fall on that standard? Am I good enough? Am I not good enough? Or am I exactly where I need to be? Um, um, so it is definitely a derivative, though, of giving and receiving love and how people are respecting you. So, of course, when I feel like I'm doing well, or I feel like that people respect me based on my performances, I'm going to have a higher self esteem than when I feel like I'm failing, or if I feel like I'm just not good enough. So though that's really the self esteem portion. So let's talk about self esteem, because we know that Maslow, there is um, a big section under that pyramid that talks about self-esteem. And self-esteem is that confidence. It's a sense of achievement. It's a respect of others and the way other people respect us. And it's kind of that longing to be unique and not the same as the next individual beside us, which is so different from, when we were younger, and we all wanted to be the same, and we all wanted to be cookie cutter. But this actually meeting that section and that hierarchy of needs, once we reach that, it is really that strength and achievement, and that we've mastered whatever it is that we sought after. We're shown competence, we have confidence in what we do, we're independent from anybody else, we have this freedom, either financial freedom, or it really is kind of encapsulates all of that. So once you achieve that under that Maslow's hierarchy of needs, it is because we're strong and we've achieved something great, and we have confidence, and we are independent. Um, that respect need is, that ability to reach that status, that to get that recognition for all of the great things that you've accomplished. It is definitely, when we think about respect, we want that attention, and to feel important, and really just to feel appreciated. So that is kind of that self-esteem and respect section under Maslow's hierarchy of needs. It's definitely a need that we have. We have to reach that at some point, or we'll never get to that self-actualization stage. We've got to have the physiological needs, and then the safety and security needs, and of course that love and belonging. But that self-esteem is really whenever we feel like we have the respect of others, and we have achieved a goal, and we have confidence, and it really is an important step in our lives throughout our lifetime. So there are 4 bases of self-esteem that Coppersmith said in 1967. I know in our book it does talk about that. He basically says there's significance, competence, virtue, and power. And this is kind of how we achieve, or how do we get that foundation of self-esteem. So significance: how much are we loved and approved? How much approval do we have? How do we feel like we are, do we feel that people that approve of us? What is our approval rating? Do people approve of us? Do we have a significance in other people's lives? So that's one. Competence is another one. So how well are we performing the tasks that we do? How well do we perform our job? Are we competent in our work? Are we competent in our family situations? How well are those tasks being performed? And are we making dumb mistakes or not? So we want to definitely have significance. We want to have competence, but also we want to have some kind of virtue, right? So virtue is the attainment of moral and ethical standards. So how morally just are you? Do you know right from wrong? So We know if we do know right from wrong and we're doing the right things, then we're going to have more self-esteem because we know we're doing right, and it kind of is a validating thing. So how morally just you are is basically that virtue step. And power, how influential are you? Are you a leader? Are you a leader within your community? Are you a leader within your job? Are you a leader in your home, in your personal life? Are you a leader within your relationships? That's that power base for self-esteem. The more power you have, maybe not power. Power is what it says, but to me, that just it's like shaking your fist type power, but really it's the influence portion of it. The more influential you are as a person, to me, that just increases your self esteem and think, man, I'm really making a difference. I'm really influential in so and so's life or this person's life or in my patient's lives. I've got some kind of power to help another individual meet their needs. So let's talk about the components of self-concept. So we're talking about the role. So everybody wants to know kind of what is your role? And you've heard, what's your role as a student? What's your role as a husband? What's your role as a wife? What's your role as this? What's your role of that? So it is a set of expected behaviors determined by your family, your culture, or any kind of social norms. So of course, within your family, you have your familial roles that you are expected to do within your family. And really, you have to have a good perception, self perception of your role performance within all of the social roles. So you have all of these different roles that you have within your job, and you have to be able to, if you don't know what your role is, if you don't know where you stand or how you feel you're performing within that role, it's going to affect your self-esteem. So if you know, I'm at work, I'm not happy with my job, I'm, not performing as like I should be, or somebody else doesn't think that I'm performing like I should be, then your self-esteem is going to start to drop. And that's basically what that means. So if we're not meeting that set of expected standards or behaviors that we're supposed to be doing within your role as either a nursing student or, like I said, your job role or your family role, then your self-esteem can definitely be affected. So here's the thing too. So once we know what our role is, so if you have a caregiver role, this is a great example. So we have patients that come in, and you might be the main caregiver for somebody that is sick or ill. You can have a role overload. There might be too many responsibilities for you stacking up, and then you can't fulfill the role that you need, or you're not doing it as effectively just because there's so much and there's so much expectations of you. So of course, when you feel like you can't be successful in your role that you're given, then you're like, well, my self-concept is going to be impaired. My whole self-esteem is going to be shot. I'm going to feel like a failure, like didn't do enough. I didn't do as good as I needed to do. You might even have some role conflict. So you might have, I think about family members that come in, and you've got the main caregiver that's caring for maybe their dad, and she's coming in and she's doing laundry and she's feeding them and she's taking them to the hospital and she's taking them to these appointments and blah 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 blah. And then there's a sister that comes in, and she comes in and maybe she's like, well, you're just not doing enough, or and then there's this role conflict, like, okay, well, what is my role? What am I supposed to be doing? What am I not supposed to be doing? And then it really does kind of conflict. And then the the roles are not clear on what it is that you need to do. So it's very important that you know your roles. You don't overload yourself with the roles that you have. And and you manage those responsibilities um, adequately. Otherwise, you're going to have some self-esteem issue, and you're going to feel like that you just aren't doing enough and you're failing. So let's talk about the development of self-concept. So self-concept really does start at infancy. It evolves throughout our entire lifetime, and it really does change at each developmental level that we have. And I mean, you can just kind of tell that so easily when you're talking about infants versus adolescents versus adults versus older adults. And you can just kind of see how that self-concept can change. So in childhood, a child's sense of self is basically shaped by all of the interactions that they have with everybody that's important to them. So it's through experiences or perception of experiences with family members or anybody that's important in their life or they see as important. I even think like teachers and classmates, teachers especially, because they are with their teachers like 8 hours per day, 5 days a week. So really, those interactions can change that child's sense of self so easily, so easily. It does, their sense of self does change as they move through each stage. So there is this development of self-concept through infancy, I had said, and that's kind of that self-awareness. That's when they start to recognize, okay, wait, I am me, right? I self-awareness of, self-recognition is whenever they're like 18 months old, 20 months old, or like 2, they start recognizing, oh, that's me in the mirror. That's me. I'm looking at me, and I can move myself within that mirror, you know. Self-awareness at infancy is like they're aware of their surrounding. So they're aware that they're in a surrounded area, that they're in a room, or they're in a swing, or they're in a crib, or they're in whatever. They've got awareness of their surroundings. Self-recognition, like I said, that's when they start recognizing that, hey, that's me on that TV, or that's me in that picture, or that's me here. Self-definition at 3 years, that's kind of starts when they're getting their little personality and they're kind of defining themselves just a little bit. They're starting to get a little attitude, because I think terrible threes is way more adequate and accurate than terrible twos. So they kind of have this defining sense of self. 6 or 7 years, they kind of start beginning to have this self concept. So that just means that they're starting to gain a little bit of confidence, or adversely, they're starting to not have that confidence. Maybe they're a little bit, that's when their self-esteem can maybe go down. They're not good enough. They're not performing enough. They're not performing well enough. So that's kind of at those tender years, you know, and it seems like too, that's when they start making you read aloud. And it's like, you know, you're getting so nervous about reading aloud, and you don't want to mess up. And so that's kind of when that begins. Let's talk a little bit about how we are going to, let me move to that page here. So we talked about, so how can we teach or develop that self-esteem and that self-confidence in children and adolescents? And I think that one of the main things is that you really have to bring out the positive for these kiddos. And you know, unfortunately, there are so many children that just aren't, they don't have any control over their own environment. And you're going to be able to see that in pediatrics next semester. It's not going to be fun for you to see. There's going to be a lot of difficult conversations, but you know, these kids, infant through 6, 7, adolescent years, when they're at home, they don't have control over what they see or hear necessarily. So it's important for us as nurses to try to help build or teach that self-esteem building to parents or caregivers. And so these are some of the things that we're going to do. So we have to make sure that we identify positive and negative for them. So we want maybe to talk about and reinforce positive qualities of a child, encourage, basically encourage that, if a child's really, really good at writing their name and they're 4 years old, we need to identify that as a positive thing, and so that so the child can learn the difference between a positive and a negative. We want to make sure that we constantly and frequently and honestly praise a child. So you kind of keep that positive reinforcement going for them. We want to make sure that as far as the negative portion of it, we need to have the parents re-examine negative qualities that they think that their children have, and ignore the ones that are like just a preference thing. Is it, well, my child is like, a little overweight. I don't know how many times I've heard that before, where, they'll say, oh, my child's overweight. And then they just fixate on that. Is that just because you think that they're overweight, or are they really overweight? And are you causing this child to have some kind of complex later on? So, is it negative that's not going to cause them harm, and don't focus on that. If it's negative and it's going to cause them harm, then you can address those negative behaviors for the child itself at that point. So another thing that we can teach to kind of help that development of self-esteem and that self-concept is to listen. So we need to put our phones down, and we need to listen to our children and let them know that they are important to them. No matter what, they matter. They are important. They are more important than a cell phone. And they are definitely able to sit down and have a conversation with their parents and know that they are being heard. So we need to be ready to listen. We need to teach the patient's family, give your child full attention, minimize any kind of distractions, practice those active listening techniques, and then invite your child to talk or speak, or, kind of give them a safe place to be able to communicate. Another thing that we can teach is the language of self-esteem. So we want to describe, so this is how that works. And let's read it. It's on page 1648. So feedback that enhances self-esteem has 3 components. All right. A description of the behavior. So what it is that they're doing. Oh, Parker, you're drawing. Oh, that is so good. That is so good that you're drawing like that. Oh, how do you feel about that drawing? Don't you feel good? Doesn't it look good? Those are all kind of like, that's kind of overly expressive, but we want to use that example. It does give us an example in the book. So a description of the behavior, the reaction to the behavior, an acknowledgement of the child's feelings of whatever behavior that is. So the book says, for example, thanks for playing with your brother tonight. I was wondering how I was going to pay attention to our guest if he got fussy, and I was really grateful that you noticed and kept him occupied and happy. I know that there were other things you might have enjoyed doing more. So that's that acknowledgement. So the description, they played with their brother. That was the description. And then the reaction, I noticed that you kept him happy and occupied. And then that acknowledgement of, oh, you have other things that you could have been doing, but you did this instead. And I really appreciate that. So that's kind of that connection of using that self-esteem language. We need to be doing that with our patients too. So we need to um, definitely not have that attacking communication. And here in the next couple of slides, I'll have that on there. Another strategy is to help children meet their expectations. So a lot of times they might have goals in their own mind that they want to complete. And maybe if they're not SMART goals, if it's not something that's attainable to them, maybe we can help lower what their goals are, and then that way we can help them meet them, and then meet them slowly. So we want to make sure that we're helping those kids meet any expectations of maybe that other people have. Maybe a teacher has an expectation of the child. We want to support that child and help them meet that expectation. And we want to promote a feeling of success. So even the little bittiest, tiniest things that we can do to kind of help praise those kids, we can kind of celebrate those little bitty successes. That's just going to improve your kids' self-esteem. So let's talk about adolescence, because I feel like that's really the hardest the hardest part to change. And really our book doesn't talk a lot about it. And I don't understand why, because I feel like that's such a huge thing. So there are so many changes in our physical, emotional, and psychosocial status during the adolescent years. It is rapid and fast, and one day you're happy, the next day you're sad. And if anybody's raised a teenager or an adolescent child, you can definitely agree that changes are rapid, they're continuous, and it's never the same from day to day. Ever, 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 ever. But I think if you're using those, if you use those same techniques, as far as identifying the positive versus the negative, listening, and use language of self-esteem, you help the adolescent or the child meet any expectations, and then promote that feeling of success in what they are involved in. I think that really does carry over from the development of self-concept for children into that adolescence. Let me tell you a story about my experience with Brecken. I think she was 12, maybe 12. We lived in Tipton, Oklahoma, and we lived out in the country on a farm. We had 25 minutes from Altus to Tipton, Oklahoma, in the middle of nowhere. And we would have this conversation every day after school. I'd have 25 minutes to where we would just get to talk. We'd talk about her day. We'd talk about my day. We'd just communicate. During that year, I think it was her 7th grade year or something like that, really hard adolescent year. She was 11, maybe 12. She, every day in the car, she would talk, she would use negative words. It would be like, I can't, I won't, there's no way. No one does this. She would always use negative words like can't, won't, will not, just so many negatives. And one day we were driving down the road and I counted, and it was too many times for me to count how many times that she was negative. And I said, for every time you say something negative, please follow it with something positive. And so that was really me trying to teach her the positives and the negatives. So I feel like that kind of made a difference in how she thought and her thinking patterns in that way. So in adulthood, we do have a perception of ourself, and that does continue to develop and change how we progress. So if we lose our job, then that could change our self-concept and our self-esteem. So when we do have periods of stability, where we're married and we have kids and we have a steady job and we've had a job for a while, we're going to have a higher self-concept and a little bit better of self-esteem. And then when something like that changes, like our sudden health, we suddenly lost a job, maybe we got a divorce. When something happens, we kind of lose that self-concept again. So here are some factors that affect our self-concept. Our altered health status can, if we're sick, if we don't feel good, if we don't feel well, if we've gained weight, if we've lost weight, if we've um, maybe gotten a diagnosis of something that is detrimental. Maybe we've gotten a diagnosis of cancer, or we're now diabetic. If we have an altered health status at that point, that can kind of decrease our self-esteem. Any developmental transitions, obviously, that adolescent ages, those growing pains, going from college to, or high school to college, from college to young adulthood, even turning 40. Uh, those developmental transitions where we're like, oh man, our self-esteem can be a little bit altered there. And our experiences, what are our experiences, our life experiences? Those can change. What if we suddenly saw something that maybe was detrimental to us? Maybe we witnessed a tragic event, or maybe something happened in our lives that we're just not proud of, or we're ashamed of. That could definitely change our self-esteem. So we want to maintain or help our patients maintain a sense of self. So we want to communicate our worth, like worthiness of our patients, with the way we look at them, the way we speak to them, and then how we touch them. We don't want to be like, ooh, don't do that. We definitely want to communicate their worth, and we need to do that for everybody. If we have a homeless person coming in, we don't want to have that judgmental look, or talk to them any differently, or speak to them any differently than we would somebody who maybe was the president. I don't know. So we want to make sure that we're communicating our patient's worth across the board. We want to acknowledge the patient's status and role and their individuality. We always, all the time, we have got to speak to our patients respectfully. Offering simple explanations for procedures definitely can help. It'll help them understand, even if we think or assume that somebody knows exactly what we're talking about. If we don't use layman's terms, they're going to feel silly and stupid when they don't understand what we're saying, and they're not going to ask any questions, because they're going to feel like, I should know this because this person is speaking to me like I should know this, and I don't know it, and I'm embarrassed because I don't know it. So we need to offer simple explanations for all procedures for all patients. We want to be respectful of our patients' bodies. We don't want to jerk them. We don't want to be rough with our patients. We definitely want to make sure that we're maintaining privacy. We want to acknowledge and allow time for our patients to express any kind of negative feelings or emotions. And we want to help the patient recognize those strengths that they do have. And if they don't, there are some people that really don't have a whole lot of strengths. We want to be able to help them maybe explore on how to hone in on those strengths. So whatever we can do, we need to pull out the positives within those patients, and try to have them look at the positives with what's going on in their life. So here's some assessment things that we can do. So we want to make sure that we're considering both the client's developmental level, so where are they at, versus their actual age whenever we're talking about self-concept, because it's going to be different. Our book has a table on, it's a really good table too. Let me find it real quick. Okay, it's on page 1638. It's table 41-1. 41-1. I want you guys to look at that. It has infancy, childhood, adolescence, adulthood, and then later adult years. So that has all of the ages. It has the changes that can affect those self-concept, and then implications for nursing, potential causes of disturbances within that self-concept. So make sure you are reading that table right there. I would imagine that there might be definite questions that are related to this table right here, and not only maybe our tests, but also the NCLEX. So we need to make sure that we're determining the client's or the patient's perception of their self-concept and what factors could affect that at that point in their life. So basically, we need to listen to these patients. We need to hear them. We need to be picking up on those cues. So we want to assess their strengths. And then that's how we're going to be therapeutic in building those interventions for them. So we want to make sure that we're maintaining a good relationship, that we're listening, we're actively listening, that we're helping them care for themselves so that they can meet their own basic needs. And we want to help them adapt to any stressors in their life positively. So if they've got a stressor, let's not open a bottle of vodka or something like that. We want to have positive outlets offer positive outlets for our patients and kind of help them adapt to certain stressors in their life, because everybody has stress. We want to make sure that they're adapting to that positively and not in a negative way that's going to harm them. So here's a list of certain nursing diagnoses that could be used. A disturbed body image. Obviously, if you've got somebody that's not happy with the way they look, maybe they've got a colostomy bag, a new colostomy, maybe they are anorexic, maybe they've gained a whole bunch of weight because they're having to be on steroids because they've got a new diagnosis of COPD or something like that. They've got a disturbed body image. Parental role conflict, definitely for our adolescent and teens. Disturbed personal identity, ineffective role performance, chronic low self-esteem, maybe just a situational low self-esteem. Maybe that colostomy bag is only going to be for a short time and they're not going to have it for a while. So maybe it might be low self-esteem during that short period that they have the colostomy until they can get it reversed. And disturbed personal identity, anxiety. We've got social isolation. They might feel isolated if maybe they're not, that something happened and they're embarrassed about what happened. Maybe they're starting to isolate themselves. Hopefully it doesn't get to that hopelessness and powerlessness, because and then that way, once it gets to that point, it can lead to risk for suicidal ideation and things like that. So this is very, very much borderline mental health discussion here, but these are some nursing diagnoses that could be affected by or could be used with somebody with a poor self-concept. So outcome identification and planning. So we have our assessment, and then now we have our planning. So we want our outcome statements to reflect specific behavior that's measurable, those SMART goals that we talked about that you guys are seeing on your data sheets, and that has an appropriate time frame for evaluation. So we want to make sure that we develop their plan, their outcome. We develop their plan, and we make sure that we've got good measurable goals for them. The nurse and the client can develop mutually established objectives. So it's really, really good to give patient-centered care when we're talking about self-esteem and self-concept. So we want to center the care around the patient. So we want to encourage them to play an active role in whatever it is that's going on with them. We always want to include them in our planning, especially when we're talking about self-concept. So we want to initiate any therapeutic interactions, and we want to support those healthy defense mechanisms that we have. And then we want to ensure that the patient's going to be satisfied, and that the satisfaction comes from both the physical satisfaction and the psychosocial satisfaction, and that those needs are going to be met. Are they happy with what our plan is? So we want to make sure that we're promoting a positive self-esteem across the lifespan throughout childhood, adolescence, adulthood. We really, really want to make sure that we are being positive as much as we can with our patients, because we know that the kinder we are and the more positive we are, the better outcomes we're going to have. And this is not a fake positiveness. You know, you can still be very positive and very, very nice and very kind when you're giving bad news. We need to make sure that we are promoting that good self-esteem, and not really nitpicking and picking and being negative as far as self-concept and self-esteem is concerned. And we want to make sure that we're doing that throughout childhood, adolescence, and even with our older adults. You know, if I think about those nursing home residents, you know, and a CNA or maybe an aide, or maybe somebody come in there and like, oh my gosh, it smells so bad in here. Well, of course it smells bad in there, but do we really need to say that out loud to where our residents can hear that and just, I mean, that to me, I would be embarrassed if I was an older adult and there wouldn't be anything I could do about the smell. So think about the little things. So after we've implemented all of our nursing interventions, we always evaluate. So we've done our implementation. Now we're going to evaluate, what do we do? So a client's behavior and attitudes will reflect the degree of progress toward restoring an altered self-concept. So we will need to change and adjust based on that, the client's response to that. And we want to make sure that we adjust the care plan as needed. So do we need to go back and do some reinforcement? Do we need to go back and do some more interventions for the patient to help them with those with that diagnosis? So here is an example. So if we have a we want to, let me go back here. So we have a nursing diagnosis here of situational low self-esteem related to a decreased sense of significance, competence, virtue, and power, as manifested by expressions of being a failure, powerlessness, fatigue, tears, weight gain, low academic performances. The expected outcome is by this time next month, the patient will demonstrate an increased self-esteem by expressing positive statements about herself. So interventions will be maybe assisting the patient into rediscovering her own personal strengths, maybe identify personal qualities and strengths that have that she possesses. Recommend that she make at least one positive statement about herself each morning and each night. Just like when I told Brecken, you know, every time you say something negative, say 2 things positive. You know, so you can kind of teach that as far as intervention. Another one is consistently interact with the patient as if she had the power to weather the crisis so successfully. So will her into it. You can do this, you can do it, you can do it. You know, try to be supportive and using those positive words and role model that positive self-concept behaviors. So those are some interventions that you can do. And once you do some evaluation, you know, the great thing would be if we can see that the outcome has been partially met. Patient statements are of this is good, but variety. And I think I'm doing better in school, but I don't know if it will continue. We might need to reassess that within the next month and see if that's maybe continue to do that positive reinforcement and maybe do a reassessment and kind of change that care plan just a little bit. Because self-concept is based on personal attitudes and feelings, it is not an overnight thing. You cannot change this in a shift. So that better not be your SMART goal time frame, your measurable time frame, because you're not going to be able to fix this. It's going to be a constant. You might see that might be a adequate care plan for maybe in a long-term care facility, maybe if you're doing home health care, maybe if you're an inpatient, maybe a long-term inpatient uh, eating disorder or some kind of rehabilitation hospital, because it's going to be a long time to be able to change a self attitudes for somebody else. You can't just change that with one click, unfortunately. I wish I could wiggle my nose and make sure that people know how great they are, because human beings are really great. All right, guys, so that is the end of chapter 41. It's already getting dark. My natural light is coming off, so I'm going to go ahead and hop off. I'm going to post the PowerPoint. I'm also going to post a couple of videos, and then I will see you guys on the flip side. I'll see you Monday. Hope you're studying. You guys take care of yourself. We will talk to you later.